All right, good morning to all. Thank you for being here and for joining us for innovative approaches to assessing the New York City home care market and job quality. We're very pleased to have you with us this morning and looking forward to sharing this presentation. So to begin, I'm going to hand the mic over to Daniel Liss, the Executive Director of the New York Alliance for Careers in Healthcare, or NIACH. So Dave, there we go. And let me spotlight you, Daniel.
Good morning, everyone, and presumably everyone can hear me. I'm seeing a couple of head nods there. My name is Daniel Liss. I'm the Executive Director of the New York Alliance for Careers in Healthcare, and I am, which is a public-private partnership with the New York City Mayor's Office of Talent and Workforce Development. We work on economic and workforce development issues for the local healthcare sector. And I am incredibly excited both about this morning's webinar and about the webinar that will be happening next month. As I know all of you know, healthcare has had dramatic changes in the past 10, 20 years with the Affordable Care Act and new models of care and financial models and Medicaid reform, an aging population and people living longer with chronic health conditions, and more recently with a global respiratory disease pandemic, which we've all felt the challenge of acutely. And just because home care, its businesses and workers aren't often seen by society at large or policymakers or the rest of the healthcare sector for that matter, doesn't mean that home care is not important and its workers are not important and that they haven't also experienced dramatic change. And so one of the things that we were the most intrigued by and excited to be working with our friends at the ICA group over the past year or so is to really understand what is actually happening in the local New York City home care market and how that might be different than the way that we all sort of talk about what's happening and what we might assume to be happening. And so it is with great pleasure to hand off the mic to our friends at ICA to really share with all of you some of the great stuff that we've learned over the past year. I will share that while I have been steeped in this work for quite a while, there are a number of things that I was not expecting out of this research, and I'm hoping that you all find the same interesting and learning.
So as Daniel just shared, we're really excited to share these findings today. So just to give you an idea of what to expect, you're going to hear from ICA Group's Executive Director, Dave Hammer. He'll deliver about a 30-minute presentation. And from there, we'll move into a Q&A session. And I'd encourage you to put questions in the Q&A feature or into the chat throughout the presentation. And if we have an opportunity to do so, we'll tackle some of those questions while Dave is presenting. And if not, we'll get to them during the Q&A itself. So without further ado, I'll bring up Dave.
Thanks so much, Faye and Daniel. So as Faye said, I'm the Executive Director of the ICA Group, David Hammer. And before we jump into this, I wanted to just take a moment to thank Daniel and the folks at NIACH for their real sort of engagement and really thoughtful engagement in this project. It's been a real pleasure to work with everyone there, and the work has really been strengthened by by their engagement and by their thoughtfulness and by their real intention of trying to improve the quality of jobs in the home care space. So it's just been, just to thank them. It's a really fantastic organization. And I also want to take a moment here to thank both the previous and the current administrations in New York City. So this project was funded by a grant that was secured in the previous administration, but we have been, but really most of it started during, or most of the work happened during the current administration. And it's really been an exciting opportunity to sort of see how New York City can really be looking to improve the quality of jobs in the home care sector and understand that. And that's a big, big challenge that people have been working on for decades. So this is just a continuation of that work and really hopefully building off of a lot of that work to bring this to the next stage of this work. So we're really excited about sharing this. And I'm going to jump in. So ICA Group is a national not-for-profit consulting company. We're primarily a organization that helps start worker cooperatives. We're a business development organization. We've been around for 44 years. Actually, next year will be our 45th year. And we've, in that time, done a lot of work in the home care space. We also do work in the, so we do a lot of research with, as part of this. So we both are sort of a research and strategic planning type organization and a business development organization. And when I talk to staff about doing research projects, one of the things I always say is in the reports that we're putting out, we need a really solid methodology section to really demonstrate that what we're, even though what we're saying might be designed for a specific objective, we want to make sure that our information is rigorous and solid and defensible and real. So that's really, kind of the approach we take. But I also say to them, when we put out reports, let's not start off by talking about methodology because, boy, that's boring. That people aren't here to talk about methodology. So with some trepidation, I'm going to start off this presentation talking about methodology. I'm going to dig myself into a hole and hopefully I can get myself out of it. And the reason I want to do that is because this project relied upon some data sources that I think people familiar with the New York City home care landscape will be familiar with and have some questions around. And so I think actually understanding kind of how we thought about and how we navigated some of these data sources, getting a sense of that, I think will actually provide some confidence in the results we have. So that's why I wanted to jump into that. And the sort of most maligned data source in the home care industry in New York City is the LICSA statistical report. And we built most of this analysis off of this database, which is basically an annual report that licensed home care agencies, which are called LICSAs in New York State, but these are agencies that employ primarily home health aides and personal care aides or home attendants to do home care work for people with disabilities and seniors. Those folks have to fill out this report. And this report has an enormous depth of data. It's an incredibly rich data source. The problem is that it was filled out pretty inconsistently for a very long time. It wasn't required. Even when it became more required, there's some challenges with it. And so this has been something where it's like, oh, we could really understand the market if we were to look at this, this data, and yet, boy, it's not particularly helpful. What we did to address that is, one, we leveraged the fact that more and more agencies are actually filling this out in a more robust way, and so the data is actually becoming more useful and painting a more complete picture. But the other thing we did is we combined this with other data sources, the biggest one of which was this New York State influenza data. So the state of New York requires all healthcare providers to submit on an annual basis what percentage of their workforce has received the influenza vaccine. And so what that does in a home care setting is it actually can tell you the number of workers that are at a business. And when in the home care industry, that can tell you a lot about that business. And so you can verify, you can complement, you can supplement, you can augment the data in that statistical report, the LICSA statistical report, with this data and really get a much richer picture, one that we can both feel confident about, but also one that we can look at both at a sort of on a longitudinal level. We can look at not just kind of a snapshot, but we can look at trends, and that trend analysis is going to be really important for how we're thinking about this work going forward. So what we did really was we took all of these things and augmented them also with some Dun & Bradstreet data, with some industry data, with some licensure data. So we really tried to pull together this thing. And when you take all of these sort of pieces together, what you wind up doing is you wind up creating something kind of like a dodo bird, right? You've got this thing that on the bottom might look like a dinosaur, on the top might look like a chicken, in the middle, like who knows what that looks like. It's sort of like a tiny weird peacock in the back. You wind up with this sort of this strange thing. But if you can make it work together, what you can actually do is you can understand the market in a really nuanced and clear-headed way. You can really paint a really full picture of what's going on. So each of these things on their own tells a story, and some of that could be interesting and powerful. But when we combine them together, what we get a place where we really have a full picture of what's going on in the market. And that's what the process we did. So you might be sort of asking, like, why am I here again? Was I here to learn about dodo birds and LICSA statistical reports? No, right? So we're here to talk about the New York home care market. But I just wanted to give that context so we could understand that a lot of the data that we're pulling from is pulled from this sort of amalgamated data source that really allows us to paint a picture. I think it's important to note and to stress that it's not perfect. There are flaws, there are gaps, but because it's such a large data set, because it has so many, it's records for each individual agency, what it does is it allows us to look at sort of trends and the shape of things in general, and it really does give us a pretty good picture of that. So it's not to say that this is like perfect in every way, but it is sort of the best picture. So we're here to talk about the New York City home care market. I love this picture of New York for a couple reasons. One, because it's difficult to find a photograph of all of New York. And it's difficult to find a photo of New York that doesn't center Manhattan. And while Manhattan's clearly in the center of this photograph, the different perspective that I think it brings, it really does allow us to sort of see the whole thing. And that's really actually what we're going to try to do here, is sort of tilt folks' perspectives a little bit to get them to see the whole market in ways we can, hopefully in the ways we can, really learn some interesting stuff. So overview of the home care market, right? So what we're going to do in this presentation really is we're going to talk about the home care market overall. We're going to talk about some of the trends in that and how those are really impacting the market. But then we're going to really dive into the details or the meat or the kind of core element of this, which is how do we understand measures around job quality using the data sources that we have available? What are the ways that we can look at? What are the ways we can measure? What are the ways we can track job quality issues? So that's really where we want to get to. But in order to sort of set the stage for that, I think it's important to understand what is sort of the context of things that are happening in the marketplace in New York State or in New York City. So New York City, we estimate that there are 528 LICSAs, which are agencies. So for folks who are sort of not familiar with the New York City landscape or the New York State home care landscape, LICSAs are what we call home care agencies, folks that employ home attendants and personal care aides and home health aides. So there's 528 of those agencies. This is not, like I said, a super precise number. Depending upon where you look at, that number can go up, that number can go down, and obviously that number is changing over time. But this is our best estimate of where things are at. Those 528 agencies represent about $6 billion in revenue. So it's a pretty large industry. And this is just New York City. And amongst those 528 agencies, we estimate there's around 274,000 home health aides and home attendants working for LICSAs. So this is not home care workers working in hospitals or home care workers working in nursing homes or CNAs. This is home health aides and home attendants or personal care aides working at LICSAs in New York City. So this is kind of a broad picture of what the industry looks like in the city. I think it's important to note, however, when we look at that industry, this is the gross margin of the agencies. So this first bar is all agencies, and then it's broken out by not-for-profit, the darker bar, and the light bar is for-profit agencies. So home care agencies or LICSs are operating with like around a 36-37% gross margin based upon this data. Now, if you're an operator of a LICSA, you might be saying, wait a minute, that seems a little bit high for what my actual practice is. I think that's probably right, that there's some flaws in the LICSA data on, specifically around some of these things. So this just gives you a sense, really what we want to sort of show here is that there's a lot of consistency on the part between not-for-profit and for-profit agencies in terms of this gross margin. And gross margin in these agencies really means that an agency has 37 or 36% of its revenue able to cover all of its administrative costs. So all of the staff who are doing scheduling, all of the folks who are doing payroll, all the rent, all of those things. Like I said, that number is actually probably a fair bit lower in practice, and there's some challenges with the data. But when we look at that, we can sort of put it in context. This is the net margin. This is the profit that home care agencies make based upon this data. And we might have some questions around the precision or the accuracy of this data as well. But as a general rule, we're going to be saying this is pretty much where we're at. There's not much money in this market. You're not making money. You're not making, as a business, you're not making money as a home care agency. It's difficult to make money at a 2%, at a 3%, at a 4% gross net margin. And I think it's also worth noting that net margin and gross margin doesn't account at all to the cash flow challenges. So one of the things that happens in New York pretty consistently, which is a huge challenge for the home care industry, is that good public policy raises the wages of home care workers or all workers through minimum wage increases or through wage increases specifically for home care workers. And then there's a period of time where the agencies have to negotiate with the state and with the managed long-term care companies and with all of the payers that are part of this to get compensated for that. And so if there's a $1 increase in the wage, what that means is that the agency has to float that amount until that piece is settled. That's an enormous cost for businesses. So not only do you have really razor thin margins, what you also have is you have really challenging cash flow problems. This is a difficult business to operate in. It is a business, it is an industry that is really dominated by crisis and chaos because the work itself is difficult. You are dealing with vulnerable populations. You're dealing with people who have real challenges. You're dealing with, if somebody gets sick, then if a worker gets sick, you've got to figure out how to provide care for this person who needs someone in their home to help them be able to live their lives. That part is challenging enough, and you've got to do it on these these really, really thin margins with these really challenging cash flow problems. So this is really just to say it's a big industry, it's a complex industry, and it's a challenging industry. So let's look a little bit at what a licensed agency looks like, what a sort of a typical licensed agency looks like.
Hey, Dave.
Yeah.
Can I interrupt for a sec? Because there's a couple questions that came into the chat about a couple slides back, wondering if the count, the 274,000 count, includes CDPAP personal assistance workers registered at fiscal intermediaries. So I don't know if that's a question we can answer now, but just wanted to raise it before we moved on. Yeah, no, that's a great question.
So it does. There's some fluidity in that data so anything that's what it wouldn't include is if there was a CDPAP agency that was a fiscal intermediary that wasn't for some reason showing up at all in the influenza data or in the LICSA statistical data as an entity. it might not include them, but the vast, vast majority of them are. And we also use the CDPAP data to the list of those to make sure, to augment this data to make sure we weren't missing those. So that 274,000 does include. And the question, I guess, the other piece is that there's another question here that I'm just looking at in terms of the gross margin. That's coming from the statistical data. It's really looking at the direct, those numbers from the direct costs to the compared to the whole costs. Like I said, it's not a it is far too high for what the reality of what, so we've done a lot of work with especially cooperative home care associates but with other agencies really looking at the specifics, and those numbers don't reflect what the reality is. I think the reason we wanted to put them out, even though they're probably a flawed source of data, and they're not necessarily fully accurate in terms of the piece, is to show that there's a relative consistency across the industry. So orders of magnitude, I think that data is not something we want to. We're not going to spend a lot of time looking at kind of the internal financial operations of these businesses using the LICSA statistical data. That is actually not what we're using this for. We do take a look at it because we've got that data in there. We're really looking at it to understand more around sort of the employment issues, and we're augmenting that. So we have a lot more confidence in these sort of employment data pieces, or the workforce data pieces that are in there, because we're really able to augment that data with other sources. But the internal operational cost data, that's very difficult to augment with other sources, and so, or to adjust, make the appropriate adjustments. So that is an excellent point and an excellent question, and one that we're very much aware of, and so let's not put too much weight into that gross margin question. I think the thing that we wanted to stress, though, is that in fact the net margin number, even if the precision of the dollar amount is not perfect, the precision of the percentages we feel is generally generally accurate, and that these are really razor thin margins that folks are dealing with. So what does a license agency look like? On average, a license agency has around revenue of around $12 million, except there's huge variation, right? 38% have revenue of less than $1 million, 35% have revenue of between $1 and $10 million, 23% between $10 and $50 million. So there's wide variation in terms of the revenue pieces, right? So while there's a pretty good picture of what the average is, that distribution is really significant. When we look at kind of how many workers are working at a place, the average there is around 504, and yet once again, wide variation in terms of that. So 26% of home care agencies have less than 25 workers. 18% have between 26 and 100 workers. So it's a widely distributed workforce. So while we can sort of look and say, oh, hey, here's this average, that actually doesn't tell you a whole picture. And even the median doesn't tell you a whole picture. This distribution is really the thing that's going to tell the picture that these agencies look different, that there's lots of variation. And I think that's the kind of thing that we want to, if we're really emphasizing a key piece in this presentation, it's that the industry is a widely varied. There's a lot of variation. Most agencies are for-profit. 86% of them are for-profit. But there's some variation there. So the other piece I would think we want to get into, and I want to kind of speed up a little bit to make sure we can get to the job quality piece here, is that there is pretty significant market concentration, right? So the 10 largest LICSAs control 23% of the market. The 20 largest LICSAs control 35% of the market. This is by revenue and by hours. And And so even though this is only 2% or 4% of the total agencies, right, they're controlling about a quarter to a third of the market. These agencies are pretty, this is a significant concentration. But I think one of the things that is really important to note here is that because there's a small number of agencies that are so significant, those agencies actually have a really outsized influence of how the market is perceived. And so, because when you look at, in contrast to that, there's also this dynamic where there's market competition, right? So 96% of LICSs have less than $50 million in revenue. Those agencies control 68% of the market. So even though there is market concentration, there's also a lot of market competition. There's also a lot of small agencies and medium-sized agencies that are operating in the New York City market. And so we've got this sort of dynamic of both concentration and competition that's going on, and that makes the market a little bit more complex and a little bit more difficult to address and to understand. Another key thing that I think is important to note is that there's really two distinct markets. So this is a distribution of how many hours folks are doing that are public pay versus private pay. So at the top end here, you've got 54% of agencies have between 90 and 100% of their hours are public pay, Medicaid primarily, whereas about 36% have less than 10% public pay. They're primarily private pay market. So you've got this situation where you have kind of these two relatively distinct markets, and that is a challenge because these companies are sometimes operating in both of these places, or they're sort of moving back and forth between these, or they're dipping their toe in one of these areas. But you've got these sort of different contradictions. When we move into the sort of looking at the data over time, and this is really relying upon that influenza data and the sort of some of the registration data, one of the things you can sort of see is that there's a fair amount of steadiness in the market, right? So this is the number of percentage of agencies based upon the year that they were first licensed. And so you can see here that 21% of home care agencies have been in operation for more than 20 years. That's a significant number of agencies that have been around for a long time. And 38% have been, started operations after 2015. And so I think we have to ask the question, could this be important, right? Could this also be showing sort of some dynamics in the market that are important? And so when we look at this, we kind of ask, like, is the market steady, right? Like, what's going on with the market? This is looking at just the influenza data. And so the numbers here are actually going to be a little bit short. We talked about 528 agencies, and here you've got 459. The reason for that difference is because of sort of flaws in or gaps in the data set. But it's what we've got to be able to look at. And what we found is that when we could sort of make some adjustments for this, that we could sort of see that the precision of the sort of company level piece wasn't quite as accurate, but the shape of the data really matched. So while these numbers, this 504 up through the 459, that sort of precise number might not be exactly right. The shape of the market, I think, is we feel really confident about. And so you can look at this and you can say, okay, there's been 54 new agencies since 2014. That sort of says something. But I think we have to ask ourselves, is the market really growing? So this is looking at that same data set, but instead of looking at it by kind of the net, where things are, the total for any year, it's looking at how things changed in any given year. So of the 405 agencies that reported flu shot data in 2014, 167 of those had closed or had stopped reporting on a consistent basis by 2020. Now, did all of those close? Maybe not. Did most of those close? Yeah, we did look at that and check. In fact, these are businesses that are going out of business. So you've got a shrinkage in the market. You've got these companies, and yet what we've got on the flip side of that is we've got growth in each of these years where new companies are adding pieces. And so you've got this growth in these different pieces, and you can sort of see this is that original shape that we showed earlier, but there's some big dynamics in that, right? There's both growth and there's shrinking. I'm sort of looking at the data from the LICSA statistical data report. So this is from the last year that I think that the LICSA statistical data is from the last year. We did this analysis last fall, so I think it was 2017, 2018 was the data year for which that was available. We made some adjustments to that based upon some of the growth projections. So we did make some adjustments to sort of test some of those things. But this is where the that's where the LICSA statistical data is from, and the trend data, the 2014 to 2020, that's coming from the flu shot data, which is released on an annual basis. So that's the data from 2020. And so when we look at the number of companies coming from the newer agencies operating since 2015, that's really looking at the flu shot data, which gives us this sort of a picture of what the dynamics of the market is. So when we look at that, we can sort of see, okay, when we look at sort of the estimated changes in LICSAs from 2014 to 2020, we can see that there are 248 LICSAs closed and 302 LICSAs opened. So when we look at this data at the sort of that trend level, that only tells us part of the story, right? When we look at sort of insights into the specific agency data, we can track the lifespan or track the life of a particular LICSA over time. What that tells us is this whole story, which is that we've got a situation with growth and contraction. We've got a dynamic market. What are some of the reasons for that? Consumer direction is a big piece of that, right? New entrants because of the CDPAP program. Some of the work or some of the challenges of dealing with managed long-term care is part of the contraction. Some of the cash flow reasons are part of the contraction. There's lots of reasons for this. But I think it's important to note that there are public policy and public health implications in LICSAs closing, because there are LICSAs that have a particular focus on a language group, an immigrant group in the city. And if the market forces are causing that agency to close, then we run into problems because we're having a market force have an implication on a community's ability to access home care in a market in a way that sort of really meets their needs. So when we look at the challenges here, right, we're letting market forces impact public policy and public health issues. And that might be an okay decision, but it's certainly one we should go into with our eyes wide open. The other thing I think that's worth noting here is that when you look at this same data, you can sort of see that larger agencies are losing market share, right? So over time, between 2014 and 2020, the 20 largest agencies, actually their market share, and this is based upon employment data, not necessarily hours, but employment data, sort of number of home health aides and PCAs, that shifted over time and has been declining, right? So we've got this situation, we've got sort of a contraction, but that contraction is not actually leading to a concentration of larger agencies. It's actually leading to a decline in those larger agencies' market power. All of which is to say that there's a lot of complexity going on in this market. And as we're thinking about policy recommendations, as we're thinking about changes, as we're thinking about systems of who, how do we build rewards? How do we build reports? We have to be thinking about this stuff. So here I want to jump right into job quality measures. And I'm going to talk a lot about kind of like high level what these job quality measures are. The thing though that I think is important is that there's information in these reports. There's information in the statistical reports. There's information in the influenza shot data. There's information in that's out there, and we can combine this, and we can, and it creates an opportunity. So it creates an opportunity to analyze the data, understand the market, right? It allows us to understand, with that analysis, allows us to publish the results around job quality issues, right? It allows us to talk about that. It allows us to provide guidance to agencies that are maybe not doing as good a job in certain areas on how they can improve. And I think the other key thing is it creates a platform, it creates an opportunity for us to reward high road providers. Now, some of this stuff has been tried in the past, and there's some, our next month, we're going to be doing a webinar where we're going to be talking about some of these initiatives. And so we're not blind to those things, but the idea is that if we can sort of collect and measure this data, if we can talk about this, we can then create a space where we are rewarding high road providers. So one of the things we did as part of this is we actually developed a set of criteria that might differentiate high road operators from others. It's a really preliminary piece, and we're actually in the process of continuing to work on this. But we did, and we're not sort of publishing this. It's like, oh, here's the right measure. This is the score that you should be getting, because it's sort of a process. It's a thing that's in process, and so it needs more work to be done. It needs more input from LICSAs. It needs more input from advocates. But it is sort of a preliminary piece that says, hey, we have the ability to potentially do this. Is there, does that work? So we looked at net margin for the companies that we sort of felt like, met this criteria. So the net margin of all LICSAs, talked about it, 3.5, that's pretty low. Net margin of agencies that are high road, 1%. So right now, it not only doesn't pay to be a home care agency, it doesn't pay even more to be a high road agency. We are not rewarding the agencies that are doing some of the most interesting and innovative pieces, right? That is a real problem. And so all this other stuff we're going to talk about is sort of some of the data points that we can collect, and I think and they're really exciting for us to be able to collect and to measure and to track and to see to improve. But I think one of the key things is that unless we're creating incentives for businesses to be high road, it's going to be really difficult for them to be high road. And so we really understand that. And that's a key piece of sort of the policy shift we need to have. So I'm getting this question around what high road is again. So what high road is we looked at a number of different factors in the that are reported in this data. So we looked at sort of a bunch of different measures. We looked at the weekly hours. We looked at health insurance enrollment, health insurance offering. We looked at there's a bunch of questions that we'll talk about, and we'll sort of highlight what some of these things are. And so we basically were able to sort of say, okay, let's create a threshold or a yes, a binary if it's a yes or it's a no on these things. Let's give them some point values and then see what happens to give that sort of preliminary measure. So we can say, what is a high road operator? What's a low road operator? Or what's a non-high road operator in this framework? And we sort of built out this preliminary piece. So that's kind of what the idea of a high road operator is. And we're going to talk about sort of some of the measures that we looked at here, and then we'll open it up to questions around that. So one of the measures that you can get from this is this is the number of hours for home care workers. This is the weekly number of hours that a home care worker gets in home health aides or PCA or home attendant gets that they work in a week. 60%, 63% of home care workers get an average of 20 hours or less per week. This is a huge problem because in the absence of actually paying a living wage or a family sustaining wage, sufficient and consistent hours are an essential way to make these jobs sustainable. That low wages plus consistent hours and enough hours actually can create sustainability, right? Or a higher level of sustainability. But low wages and precarious hours, that's a recipe for intense precariousness for these folks, right? So this is one of the key measures: is how many hours are agencies offering to workers. And I want to recognize that sometimes workers don't want as many hours, and so there's a give and take there. So that's a thing we have to measure and we have to account for. Another piece that we looked at is turnover. Turnover in New York State, or New York City rather, is quite low, and it really, to be frank, makes us sort of question this data, the validity of this data. This is really looking at sort of the average number of workers at point A and point B during the course of the year, and then looking at as how many separations for each of those workers. That's an area where sort of data, the rigor of that data might not be quite as what we want, and we might sort of expect these numbers to be higher, especially considering you look at like turnover rates industry-wide, looking at 65% or more, right? But it could also mean that New York City, in fact, is a different kind of market. And so, we need a way to verify some of this stuff. But it's turnovers are really, and the reason we talk about turnover as a measure of job quality is that in home care, the best way to measure care quality is the relationship between the caregiver and the client, or the caregiver and the consumer. And so if that relationship is stable because you don't have turnover, then that relationship is going to be better. And therefore, the quality of that care is going to be better because the life of that client is going to be better. So there's a direct relationship between both job quality, right? Consistency of hours, consistency of employment, seniority, growth in wages, those kind of things, and care quality. That's what we thought about turnover. The state also asks sort of these questions around non-wage supports. And so these are some of the other kind of factors that that are asked in this question of, do you offer employer-provided health insurance? Do you pay a weekend differential, or a holiday differential, or some other kind of differential? Do you provide support to transportation support to staff, benefit assistance to staff, peer mentoring, scholarships, childcare support? And you can sort of see, there's some wide variation around these sort of these offerings. There's also some challenges in terms of if this is completely accurate. We actually definitely spent some time talking to folks who were definitely doing peer mentoring in this program, and we look at the data, it's not marked as that. So there's some issues there. The other key piece that I think is important that we want to look at is like not just the offering of health insurance, but the utilization of health insurance. And so one of the things that's really striking here is that according to the statistical data here, we're looking at 84% of agencies, only 0 to 10% of their staff are getting health insurance through them. Right? So that's a real challenge. And I'm not saying it's a problem. It's like the fault of the agency. There's a fault of, there's a cost, there's all of these issues, but it's certainly a thing that we need to be thinking about. So I'm getting a question of where the non-wage support data came from. That's also from the LICSA statistical report data. So it's asking questions, did you provide this issue? Did you provide these things? So there's some, potentially some gaps in that data, but it's certainly a question that's being asked. And most agencies did in fact, provide an answer to some of them. The last thing we want to talk about before we end up, and I know we're kind of over a little bit here, is that when we're looking at the how much of the market is unionized, because unionization I think matters a lot. And this number is actually a little bit complicated. So if you look at just the number of agencies, 24% of agencies are unionized. This is also from the statistical report, so it's a few years out of date. When you look at hours or revenue, it's about a little bit more than 50%. And when you look at just the number of workers, it's around 43%. So there's lots of ways to look at union density in the industry. But what you can find is that, and I think sort of looking at all of these is probably worthwhile. But what we find is that over the time, the rate of unionization is declining. So when we looked at applied this data to that trend data, what we found is that over the course of between 2014 and 2020, there's a general trend down with some uptick in 2016, but a general trend down in unionization. And we're going to argue this is bad for workers because when you look at some of the differences here, union workers, 17 and a half hours is their median weekly hours. Non-union workers, it's 14 and a half median weekly hours. Neither of those are necessarily significant or sufficient, but you can sort of see there is a difference that union agencies tend to provide both higher number of hours and have a higher hourly wage. And so if unionization is declining, that's going to have a negative impact on workers. It's also going to create a situation where we're running into sort of a lot of challenges in terms of policy shift because the union provides a voice for workers. So when we come from this, where do we go from here? The thing that we're really looking at here is we're going to be taking this work and we're really trying to build a way to understand what is the sort of the next steps. So we've built this sort of preliminary high road identification metric. It's not perfect. We're not particularly, we're not thrilled with it, both in terms of the data and in the precision, but it is a start. And we're actually in the process of working on a feasibility analysis for creative implementation of this approach in New York and possibly other regions. I think one of the things that's really critical to note here is that this work is built on a long history and a long legacy of folks focusing on building and understanding what a quality job in the home care space is. So if you're not familiar with PHI's 5 pillars of job quality, this is the base by which we're looking at. It's an incredibly powerful document and a real clear picture of what we think, how we can sort of think about a job quality. And the question is, can we use the data that's out there in the world to measure and evaluate that? So that is really the question we're going to. I realize we went over, but I want to just sort of remind, make a pitch for folks that to join us for part 2 of this session, where we're really going to be talking. It's going to be a panel discussion. So it'll be less of me, which is good. But it'll be a panel discussion of folks who are doing some innovative approaches in other areas around the country, and sort of an exploration of some of the approaches that we identified as opportunities there. And both my contact information and Faye's contact information is available here. And if we have any more, I think I'll sort of turn it back to Faye for the rest of this stuff. So.
Great, thank you, Dave. So we're going to move into our Q&A now, and I think we've gotten a bunch of questions throughout the presentation, some of which have been answered in the chat and in the Q&A already. But Dave, I think we can start with, there were a few good questions about the hours data. One, could the hours data be impacted? Could it be low because aides work at multiple agencies? And also, isn't it important to look at average hours for workers in relationship to average hours for patients, given a trend toward lower utilization of PCA services for the plan? So a couple different angles on that question about hours data that I wondered if you could comment on.
Yeah, so that question, the point around folks working for multiple agencies is a really excellent one, and there's not a way for us to measure that without talking to workers themselves and understanding from the worker perspective what their hours look like. So this is really, the data really does limit us to be able to look at it at the agency level, and that's a really powerful measure. but it really does, this is a market where people are moving in and out between agencies. And so that's a really important point. We would need a mechanism to collect that data to be able to assess that. So that is that's a data challenge, but boy, I would love to be able to get that and really understand it. To the question around utilization, I think these are all really important points, because I think when we look at the issue of what's best in home care for the client, or what's best for home care for the system, or what's best in home care for the worker, and what's best for home care for the agency, sometimes those things are in conflict, and that is a problem. The reason we like cooperatives at ICA is that one of the problems it solves is that the incentives for the agency and the incentives for the workers, because the workers become the owners, become much more aligned. And so you actually have, you sort of solve one of those contradictions. But I think there is a real challenge that we have to think about is, if we built a home care delivery system, or a medical delivery system that is built off of precarious work for immigrant women, that seems to be a pretty problematic solution to a public policy piece. And so we need to figure out, from a workforce development or from a workforce perspective, how do we address that job quality, that issue, if in fact sort of shifting hours or moving hours around is in fact a thing that's beneficial for clients or for consumers. If that's a beneficial thing for the system, which I've got some questions around, but if it's a beneficial thing for the system, that might not be a problem, but the consequence is it's a problem for those workers. And if it's a problem for those workers, that becomes a problem for the system, because precarity amongst instability in the workforce is going to create problems for the system. So I think those two things interact with each other in a significant way.
Thanks. Next, we also have a question in the Q&A inviting us to talk more about those measures or qualities of a high road operator. So I'm wondering if you could comment more on that piece of the analysis, what data is currently available, what's possible with that data, and any limitations.
Yeah, so for us, the big sort of exciting takeaway for this analysis was that when we were able to both kind of get a richer utilization of the data, more people filling out the data, more LICSAs filling out the data on the statistical report, and when we were able to really sort of verify some of that data using some of these outside sources, so we felt pretty more confident around some of those higher top line level data sources. That allows us to really to put some rigor into sort of some of the middle line data sources. So what that allows us to do is really say, okay, we've got kind of information on average number of hours. We've got potentially a way to calculate turnover. We've got a way to calculate utilization of health insurance. We've got a way to calculate how different, folks in terms of workers' compensation around utilization of vacation and paid time off. So we have a way to not just look like, hey, do you offer vacation, or do you offer health insurance? It's sort of like yes, no. It's a way to, we potentially have a way to look at the utilization of that. And that becomes something that is a lot more kind of interesting and important or influential in terms of deciding like, hey, is there differences here, right? Like you can offer insurance, but if nobody takes it, does that make you a high road employer? Or are you working, to figure out like how to provide, health insurance, or are you working to provide how to get Medicaid for your employees? Because in fact, the system is, that we've got is not, not sufficient. So with this data, the thing that we're most excited about is that we can really do some kind of nuanced looking at some of these pieces to capture a picture of what this is. So it's not just sort of a yes, no, did you do that? Although the yes, no, do you offer this? Do you have this? Those are really valuable, but it really can sort of dig into some of those pieces. And so we're going to be pulling together and publishing kind of some of the key pieces of what that what those sort of factors are, but they're really built around they're really centered around those 5 measures in the PHI pillars of job quality. So it's really looking at sort of supervision practices, training practices, family sustaining life practices. I'm not remembering all of them right in front of me, but it's really kind of pulling to try to understand how do we sort of, if these are the the pillars, how do we build measures using that data so that we can start, even if it's just done internally, to really start to sort of get a sense of how different agencies are interacting. So that's kind of the piece around this. Is it's the excitement is really that we can use this data to sort of start answering some key questions and testing some hypotheses, and hopefully making some headway in addressing some of those things.
Great, thank you for that, Dave. So we're bumping up against the end of our time here, and we really appreciate everyone joining. I'm going to pass it back to Daniel Liss for a quick closing word. And please see the chat also for a link to join for the next webinar.
Yeah, and especially for anyone that was curious about the what high road practices might look like, this next webinar is the thing to register for. The thing that really struck me, both with the presentation today, as well as all of the really smart and sharp questions around data that came in through the comments, is that just as home care has been underinvested in comparison to the rest of the healthcare sector in lots of ways, it has been underinvested in data and analytics and understanding what's actually going on. And so that is part of why we're so excited about this project together. And also one of the things that we as NIH, and I know this is a priority of New York City government as well, are looking to try and invest in and figure out ways to do more of in terms of data analytics and what is really going on with our workforce. And so looking forward to getting better data, really. All that said, though, I think this was a huge step forward, right? And a step in the right direction of compiling the sources that we do have to try and make meaning out of it. So thank you, David and Faye, and all of the folks at ICA Group. This was really great.
Thanks, Daniel, and thanks, Dave. And thanks to you all for joining. We really appreciate you being here. Our emails, our websites are in the chat. We encourage everyone to reach out who's interested in learning more or has follow-up questions, and we will make sure to send this recording to you. And we hope to see you again on November 17th. So thank you. Have a great day, everyone.